Good morning, this is Dr. RG Rivera. So today I received a message from one of our nurse educators just asking for some assistance with the checklist or the nursing laboratory checklist. I think it's for the different treatment modalities that we can provide to clients. So I hope this is the right one, but these are what I found. I cannot send it to everyone via email because it's under a copyright. So I just took a snippet. So first is this one, psychiatric RN skills checklist. So this includes medication like return demonstration, acute intervention, like what is the student's knowledge in terms of medication, seclusion, restraints, knowledge about legal responsibilities, um, ano nga ba yung mga interventions with acute suicidal for them, and then C is for management of suicidal patient, and then child psychiatry, ano ba yung mga disorders and treatments and all that, adolescent psychiatry, legal aspects, um, and then some specifics with age group. So this is what I found. I also took a screenshot of other skills assessment that I found. So this is the basic interaction skills. What I can recommend is so kahit na naka Zoom meeting or naka um, na hindi tayo in person, we're not providing anything in person with our students, we can still do this. Um, what I can recommend is do this one with one student, and then the student will introduce himself, and then you will be giving him a scenario and all that. And in terms of the grading system, you need to double check nonverbal cues, facial reactions, and all that. You may want to do ad libs or yung to give some, so you may want to be the client para what questions or what um, message you want to give the students. And then the other one, actually it's the same. Um, and then this one is about therapeutic communication. So again, you don't want the students just to memorize everything. Um, the goal is to help them build that critical thinking skills. And as we all know, it's easy to memorize things, but it's hard to understand or comprehend concepts. So maybe what you can do with therapeutic communication skills is again, um, pretend that you're the patient, and then um, for you to be able to do a role play, make sure you have a scenario. So you can use one of the scenarios that I've been giving out to everyone, or you can do one for yourself. You can also write down yung verbatim responses na gusto mong gamitin as the patient, and then that this is the time that you're going to grade the students. So to be honest, this is a good um, assessment for students kasi they will learn how to respond to you then, so regardless if you're using Zoom or in person, this is a crucial one. This is something they need to practice, or even us. Another one that I found is more specific with, for example, anxiety disorder. Same concepts or elements. The only thing different is, for example, you need ano yung mga interventions that you want to do. For example, the student needs to reduce yung stimuli, assist the patient to lower the level of anxiety and all that. Another one is, so this one is specific for clients who is having assaultive behavior. So if you noticed number 15 to 25 or to 24, yan yung mga interventions that you want the students to be able to know. Um, oh, that's about it. So I didn't really see any checklist specific to any therapies yung tinatawag nating um, mga individual therapy or group therapy, maybe because again we're limited in terms of our scope of practice as nurses, and the we are more focused in terms of therapeutic communication skills, nurse patient interaction, motivational interviewing, psychoeducation, psychopharmacology education, and then lifestyle modification, education. So yun yung usually na nasa forte natin. So maybe you can stick with those. But definitely these are the checklists that you can use, you can modify, and hopefully this can add to the things that you want, that you need to provide the students. So that's about it. Thank you. Have a nice day.